Good day, everyone. I am Lloyd Ruiz and I'm going to report about Tourette syndrome. Have you encountered a person with Tourette syndrome? Have you seen the viral Grab driver Mr. Marlon Fuentes? How about the famous singer Billie Eilish? She has also a Tourette syndrome. So let's tackle this topic because this is a very rare to Filipino people. While no exact figures are readily available for the Philippines, the prevalence in the Filipino population is likely to be comparable to the global trends. Around 1% of population, assuming similar environmental, genetic, and healthcare factors. However, because Tourette syndrome is still under-recognized and underdiagnosed in many parts of the world, including in some Southeast Asian countries like the Philippines. The actual number of individuals living with TS might be higher than reported. Tourette syndrome is a neurological disorder that may cause sudden, unwanted, and uncontrolled rapid and repeated movements or vocal sounds called tics. TS is one of the group of disorders of the developing nervous system called tics disorders. If you have tics, you cannot stop your body from having them. The first symptoms usually occur between the ages of 5 and 10 years, generally in the head and neck area. These may progress to include the muscles in your torso, arms, and legs. Causes. The cause of the Tourette syndrome is unknown, but some research suggests that it happens when there is a problem with how nerves communicate into certain areas of the brain. Tourette syndromes affect more boys than girls. Most people with Tourette syndrome experience their worst tic symptoms in their early teens, but tics typically lessen and become controlled by the late teens to early 20s. For some people, Tourette syndrome can be a chronic condition with symptoms that last into adulthood. In some cases, tics may worsen in adulthood. Risk factors. Tourette syndromes appear to result from a complex interaction of genetic, neurobiological, and environmental factors. While some of the most significant risk factors include the family history of Tourette syndrome, certain neurobiological imbalances, and childhood environmental influences. It's important to remember that the exact causes of Tourette syndrome are still not fully understood. Understanding the risk factors can help guide early recognition, diagnosis, and management of the condition. However, since many factors are beyond our control, it's essential for families and individuals to focus on supportive interventions, treatment, and coping strategies to manage the symptom of Tourette syndrome effectively. Signs and symptoms. If you have Tourette syndrome, you may experience simple or complex motor tics. They may range from very mild to severe, although most cases are mild. Simple tics are sudden, brief, repetitive movements that involve a few muscle groups. They are more common than complex tics. Simple tics often precede complex tics. The symptoms of Tourette syndromes are primarily characterized by a motor and vocal tics, which can vary in frequency, severity, and complexity. Associated conditions such as ADHD, OCD, anxiety, and learning difficulties are common in individuals with Tourette syndrome. These are sample of motor tics include eye blinking and other eye movements, facial grimacing, shoulder shrugging, head or shoulder jerking. While simple vocal tics include repetitive throat clearing, sniffing, barking, grunting. Complex motor tics might include facial grimacing combined with a head twist and a shoulder shrug. Other complex motor tics may appear purposeful, including sniffing or touching an object, hopping, jumping, bending, and twisting. To diagnose a Tourette syndrome, a doctor will ask if you have presence of both motor and vocal tics that occur several times a day, every day, or intermittently for at least 1 year. Onset of tics before age 18. Tics not caused by medications, other substances, or medical conditions. Currently, there is no cure for Tourette syndrome, but treatments are available to help manage some symptoms. If tic symptoms are mild and do not cause impairment, you may not need treatment. If your symptoms interfere with daily functioning, There are effective medication and other treatments. Some medications may have or cause side effects or should be carefully managed by your physician and healthcare provider. How to manage Tourette syndromes. Behavioral treatments such as awareness training and competing response training can be used to reduce tics. A recent National Institute of Health funded multi-center randomized controlled trial called Cognitive Behavioral Intervention for Tics, CBIT, showed that training to voluntarily move in response to a premonitory urge can reduce tics symptoms. Other behavioral therapies such as biofeedback or supportive therapy have not been shown to reduce secondarily social and emotional problems that occur. Psychotherapy can help individuals cope with the disorder and deal with accompanying problems and conditions including ADHD, depression, anxiety, and OCD. Here are some key caregivers interventions that can be helpful for individuals with Tourette syndrome. First, understanding the condition. Educate yourself and others. Avoid blame. Second, managing tics and stress. Create and calm environment. Encourage relaxation techniques. Third, support with behavioral therapy. Comprehensive behavioral intervention for tics. Support practice. Fourth, managing medication if prescribed. Fifth, fostering a supportive social environment. Promote social acceptance. Encourage participation. Address bullying or stigma. Sixth, encourage positive coping strategies. Focus on strengths, fostering independence. Seventh, provide emotional support, emotional validation, address family dynamics. 8. Monitor and adapt the changes. Track tics patterns. Adapt as needed. 9th, provide practical support. Organize routines, transportation, and daily tasks.